So the military was apparently then brought out to that particular hospital where you've been monitoring. How does it look now? Have people been able to, have community members been able to access that facility today?
Yes, so I think what's important here is that the military health services were brought in given the volatility at this particular hospital. What we do understand is that as the minute the military health services are deployed, you have a situation where the military will then be deployed in the same area to oversee and basically protect the infrastructure. We do know that last week the Telemokoerane hospital here in Vosloorus, where we are, was severely impacted with many patients unable to access the hospital, and this is why the provincial government decided, together with national, decided that there needs to be further intervention. I'm not exactly sure if, we do still see the military here. I'm just going to move out of shot and ask my colleague Mokomoti to just show you that the military are still here. They are assessing the situation, given that court judgments that's basically saying that all Nehawu workers or members that are striking need to stop the strike with immediate effect. That strike has since been interdicted, and the courts has given Nehawu till 1 o'clock today to inform all members that the strike has been interdicted. We are still trying to, of course, get a response from, an official response from Nehawu. What we have gotten so far is that they are, of course, waiting for their legal team to assess and study the judgments, and then they will be able to give us a full response at a later stage. What's critical here, Maseko, is that what we do know is that specifically in Gauteng, it's Big Mlangeni, it's this hospital that's severely affected, and Sebokeng Hospital. Those are the three hospitals that are really struggling in terms of capacity. They don't have enough staff. We do know that in Sebokeng Hospital, the hospital was completely shut down with the military services being brought back in. So we did try and get a response from Nehawu members here at the Telemokoerane Hospital, but they have said they need to wait for official response from members higher up before they are able to give any indication. So there's been singing and chanting here and there, but nothing too intense, as they have not been allowed to move any closer to the hospital as to where they are right now.
All right, Heidi, and in terms of community members, have you been able to speak to them about how they were intimidated during the days that Nehawu members were actually striking outside that facility?
Yes, so we did get a chance to speak to, patients and people who have been trying to access the hospital. There was one particular mother who said to me she had to sleep here last night because her son was discharged on the 2nd of March, and she was told to come back on the last week Monday, which was the 6th of March, and she says that because of the strike, her son was unable to get his crutches because he broke his leg, and she's back today, and she says that it's a complete mess inside the hospital. Many have opted to just not come to the hospital because they're unsure of what it's going to look like. They're unsure if they're going to be able to gain access given the volatility that we saw last week. So many are just opting to stay away, while others are saying they have no other choice but to come in here. You're seeing those that are in desperate need of health care, pregnant women, you're seeing the old and the frail coming in. So people are, still trying to access the hospital, with many saying they're just unsure of what to do because of the process that's happening, and because last week the actual entrance of the hospital was blocked off.